Hi, Susie. How are you?
Hi, Risa. I'm great. How are you?
Good, good. We're going to be talking health insurance today, and I'm really excited because we usually talk about real estate, which of
Mm-hmm.
course is very
Of course.
important and great and all that. But health insurance, of course, is always at the top of people's list
Correct.
when thinking about relocating to Mexico.
Mhm.
And so I wanted to kind of ask some of the questions that people have been asking me actually
Sure.
over the last few years in terms of health insurance, specifically for foreigners and expats.
Okay.
But so why don't you kind of actually give a little bit of context, because you actually sell health insurance, is that right?
Correct. Yes, I did get my license. I work with somebody else since my focus is more on real estate. But I worked with, the people that I worked on the certification with was GMP. It's the largest insurer in all of Mexico. And they have been around for, now for like 120 years. So it's a very stable, it's a very solid company. So by law in Mexico, people cannot be denied insurance, which is a very important point. There are statutes of limitations on age, on what you can apply for, but you coming as a foreigner, you cannot be denied insurance. The typical cutoff age for health insurance to where you can like purchase in Mexico is 65 years old. However, there are a couple of companies that will insure somebody that is up to 70 years old. So
So that
this
actually, not to interrupt, because that's a very important point and something
huge.
that is brought up all the time, right?
Mhm.
And brings up a lot of confusion. So what does that mean? So if you're 65 or older, you cannot purchase Mexican national insurance, correct?
Correct. Correct. Yeah,
But
that
so
is
what is the workaround for that if you're 65 or older? Because a lot of people do go to Mexico to retire. Do they
correct.
need to keep their Medicare and their insurance back in their home country, or
So,
um,
okay, so there is a couple of hospitals, but they're in Mexico City because Carlos Slim, who is like this very wealthy Mexican entrepreneurship that has a lot of businesses, all over the world, all over Mexico. There is a couple of hospitals that he owns where even people that have social security could use. I don't know the names of the hospitals, but I know that there is a couple in Mexico where somebody from the United States that has the Medicare can use those facilities. There's not a lot of them. There are none in the state of where I am, which is the state of Quintana Roo. And going back to the question as far as like health insurance, it works a little bit different here than it does in the US. But most of the insurance companies will insure people that are up to 65 years old. Like after that, it can be a challenge to find a health insurance, a Mexican health insurance provider. Um, there are a couple of companies out there that are Mexican, that is national insurance, that will insure somebody, an expat, up to 70 years old. It's only a couple of them, and obviously the costs are going to increase because of the obvious reasons. There is a lot of people that you can keep some of the insurance that you might have in your home country, but it's very important to ask that insurance provider if that coverage is accepted in Mexico. There are some that are, there are some that are not. Something that I always recommend everybody because it does work: travel insurance. Whenever you're coming, even if it's for an extended period of time, to buy the travel insurance because it does afford you some coverage. As far as like how does it work here? So like the expense of medical treatment here in Mexico is much different than it is in the United States. So the coverage, the way that it works here is for like,
actually, can I? I'm going to just go back, and I'll ask that question that you're just
okay,
about to go into.
for sure.
So before we so before we move on,
Mhm.
okay, so what you're saying is for Mexican national insurance, there's an age limit of 65 or 70, depending on the company.
Yes.
So as a foreigner or as an expat, the options are to get travel insurance. But I do
Yes.
understand that there's also international insurance companies that will insure people who are 65 and older.
Yes.
Generally, they're not cheap, as far as I know,
Sure.
but they are available. And
They
I
are
think
available. Yes. Yes.
um, okay, great. And because I know that there's some people who have, weighed the choices of, I've spoken to some people where they've had like to have like a hip replacement surgery or knee
Mhm.
replacement or something like that, and they weigh the odds of whether or not to have it back in, the US or Canada, or just have it in Mexico. And the couple that I had talked to, they're both
Mhm.
over 65 and they chose to do it in Mexico with their international insurance
Yes.
because it ended up being the same as paying their copay and paying for the surgery, in the US.
Mhm.
So so it is expensive, especially if you're over 65, and also I guess if you have pre-existing conditions,
Yes,
right?
that
So maybe
is.
we can move to pre-existing conditions. So how does that affect whether or not you can get insurance in Mexico?
Okay, so when you're filling out the application or whenever you're asking for a quote, as you're speaking to like the insurance agent, to the person that you're like working to get like the quotes from, that is something that is very important to disclose because different types of ailments are going to have different statutes of limitation. So it really would depend on whatever that ailment is and how long ago did you have it. My recommendation is always is disclose it, whatever it might be, because then that insurance person that you're speaking to is going to be able to tell you, okay, if it's been this many years, it's something that it really doesn't matter. But there are certain things that obviously have longer statutes of limitations for them to be able to have to like to be disclosed. The important thing whenever you're talking to somebody and be completely out front about what those ailments have been is that they can guide you so that in the future, say that there was like some sort of medical treatment that you had to have and they discovered that there was a pre-existing condition and you did not disclose it. I mean, the insurance company could like deny the coverage because it would be something that was hidden. So it's always better to act on the side of caution and disclose it, even if it's something that was, I don't know, 10, 15 years ago. It's just always better to say it. And that way the responsibility is not going to lie with you as the client, as the person trying to get the insurance. It will lie with your advisor, with the insurance person, because the way that they work is once they have all the information from you, they're going to directly talk to the insurer, and then the insurer is the one that is going to determine what is important and what is not. I mean, and I'm talking even down to like if you broke your arm or there was something, it's just always good to always be out front about it because there are things that are not going to affect the cost that much, really. I mean, unless there was something that was really, really big. And then that's also going to help determine like the amount of coverage, what they're going to be able to do for you.
Right, right. Well, that makes sense. So,
Hmm.
in order to get, so you're speaking about Mexican national insurance, though, right? In
Correct.
terms of pre-existing conditions. So,
Hmm.
do you have to be a Mexican citizen or a permanent or temporary resident in order to even be eligible for Mexican national insurance, or can anybody? And then, when it comes to like international insurance, do you need to have some sort of residency visa status?
So no, you can buy for Mexico national insurance. You don't have to be a permanent resident or temporary or a citizen. Everybody under Mexican law is allowed to purchase health insurance. So even with your tourist visa, you're going to be able to do it. With the international ones, they like to see. some sort of documentation showing that you're in Mexico, but on the requirements on that one, I am just not like as 100% clear as I am with the insurance here in Mexico. But
Right.
yeah, no, here anybody can buy it. You can apply for it, and it's something that by law cannot be denied to you.
And what kind of premiums do you see generally? So say you're in your 50s and you're, fairly healthy. Do you have to have a physical and all that kind of stuff? And how much, I'm wondering like how much should people be budgeting for health insurance?
Well, like I mean, that is something that is, I mean, night and day difference, say with the United States, which is what I am very familiar with, for example. So the way that insurance works here is you purchase for like major medical procedures. So it's called gastos médicos mayores. So it's an insurance that you buy and that you would only use. I mean, you always talk to your insurance person if you have something big that you have to go to the hospital for. Because, for example, a doctor's visit here is incredibly affordable and you don't need to pay insurance. I mean, say something little like a cough that you're not feeling great. I mean, like, honestly, you could go to the pharmacy, they have a doctor on site, and then you pay like 50 pesos for the consultation. So, I mean, you're talking like $2. And for something,
Crazy.
I know, but for something that is very simple, very small, you can always do that. Even going into the hospital to have to do some sort of checkup or something, it's not something that is going to cost a huge amount of money. Even when I had, say, with my kids, that I had to take them for like a little checkup or something, I mean, I never paid more than, I don't know, $75, for something that was not very big. Um, Once before even having insurance, and I will give you this example with my daughter, she ended up having appendicitis. And it was an emergency procedure, and it was at a time that I didn't have any kind of health insurance or anything. But like I was able to pay, it was $3,000 for the surgery, the hospital, the food, and she was in there for 3 nights. And but that was like the total cost. So that's what I mean. Sometimes it's just difference between the countries. So things here, when it comes to major medical expenses, that's when you're going to need the insurance. So what you would initially do is you speak with a representative from the insurance company, and they're going to ask different questions. I mean, like your name, your address, to see where you live, see what hospitals are going to be like within your coverage, what type of coverage is available. They'll ask you if you smoke, if you don't smoke. This is when they will ask you if you've had previous illnesses, what sort. So once they gather all that information, then they send that to the to the main insurance company, to the home office. They give them all your information, and then they come up with a quote. For example, like myself, I pay in pesos per year for my insurance, for my major medical expenses, around like 32,000 pesos, which is around like, I don't know, 1,500 $1,600 a year for my insurance. And
A
it's
year.
and it's for major medical expenses. So I have a deductible that is, I want to say, like 25,000 pesos in case, like I end up having to go into the hospital. So it's not a crazy huge deductible, like $1,000, which it really is not bad, but then from then on, it covers everything. I also have international coverage. So if something happens to me abroad, up to $100,000, they will cover me. And then there's also like transportation wherever I'm from, that they can fly me back to Mexico and continue my treatment here. So actually, it works out really great. because for like small things, like I said, like doctor's visits and things like this, I don't need to go. I mean, unless something were to like pop up that I needed to enact the insurance, then I mean, and you work with your agent, with the person that sells it to you, because they're the ones that can guide you and help you and take you through the whole process. And that's one thing that has been very nice for me, to have that assurance that there's somebody that can guide me on the phone and take me through the whole process, and they're not just going to like, I don't feel like abandoned or like, oh my gosh, I'm on my own to figure it out.
Right. That's great. That is like worth its weight in gold, right?
Yes.
I think that that's just knowing that you're taken care of and you're not going to go bankrupt,
Yes,
if you get sick, because that's a real thing here in the U.S. That
very
if you
much
get
so.
sick, and unfortunately, I've had friends who literally have gone bankrupt because
Mhm.
they developed a disease and they just couldn't afford to pay for it. So so in terms of, I guess, if someone is then going to be there, say, what do you recommend for people who are like snowbirds and that sort of thing? That they're not there permanently. Are they still
Mhm.
eligible for Mexican national insurance, or in that case, do they just do like travel insurance? Like if they're there every year for, let's say, 3 to 4 months.
So they could have they could buy insurance here and have it, but I mean, like you would have to like be very comfortable with the coverage that you have, and that you see with the travel insurance, because that's probably gonna suffice. Unless you have like a serious medical history that you just want to be able to be like extra covered, then then in that case I would suggest also getting some insurance here. There's different insurance companies. Like I said, the company that I work with or the one I use is the one that is like the biggest one, because I figure, well, might as well go with the biggest guys in town. They have an excellent reputation, and no, they do a good job. And anytime that I've had to get a hold of anybody, I've always had excellent service, so I can't complain. Why would I prefer anything else?
Right. No, that's great. What about prescription medication coverage?
So that is going to be like an out of pocket expense, but also it's just the costs are different here. It's going to be different. It's just you don't have, because like the way that the insurance works, the costs for medicine here are not as crazy high as they could be, like say somewhere in the United States. There is a lot of things here that are also available without the prescription. One of them, which is ironic, but that you like 100% need prescription for, is antibiotics. Like you'll never be able to get antibiotics without a prescription. That's something that is very regulated. But like the doctor will give you the script, and like I said, in the experience that I've had, whenever I've had to purchase medicine, it hasn't thrown me back like, oh my god, this is so expensive. For more serious ailments, obviously under the major like the gastos médicos mayores, the major medical expenses, then there would be a portion that would be included into that as well.
So you mean like, so say you have cancer, for example, and you need cancer medication, pain medication, or whatever. So that would be covered under your insurance? Is that what you're saying? Or that would be something that's completely separate?
So, like the treatments are going to be covered, like the medicine is going to be a part.
I see.
Like
I see.
everything has to be with the treatment, yes.
Right. And
Medicine.
actually, I did speak with a healthcare consultant many months ago. And so what she also recommended was for people who are on prescription medication, because there are millions of people
Yes.
who are,
Yes.
to be very careful though when you go to Mexico. First of all, when you do relocate to Mexico, first of all, you do want to talk to your doctor down, whoever your doctor ends up being in Mexico, and making sure that that medication is available in Mexico, whether it's
Yes.
the generic version or whether it's the brand version.
Hmm.
Um, and that's something that you can do before you go. And then also kind of sticking with more of the big brand named pharmacies, right?
Yes.
Like the Guadalajaras or whatever, that to make sure that the medication that you're getting is actually the medication.
That is correct. No,
That
it's a serious thing, and it is a very important, very, very big point, because I mean, you have all kinds of different pharmacies, and like, I mean, like, because of the FDA, the United States, you have more regulations, more restrictions, and onto how medicine and like how all of that moves. Not that there isn't in Mexico, because of course there is, but I mean, there's also places where say that you could buy like anabolic steroids, and it's like, like readily available. So probably don't go buy your medicine over there, because who knows how clean it's going to be or not, depending. But yeah, staying with the major brands, with the ones that have like but not only a good reputation, but they have representation around the country. That's always going to be like the standard, because they're going to be held to that higher standard. For example, for me, like whenever I have to purchase my medicines, I mean, there's only like 2 pharmacies that I go to, but it's the ones that always have like the availability on what I might need, and I mean, and they have the brands and the quality, and there's nothing like dubious or doubtful or anything like that.
yeah,
But
no,
it's very, very important to make sure that, especially when you have like a serious condition that requires a specific medicine, that you make sure that it is available here, and where, and where you're able to get it.
that's great. So as we kind of begin to wrap this up, what are some of the I guess, parting thoughts or some advice that you'd like to give people who are looking to relocate to Mexico? And of course, healthcare is on their minds.
Mhm.
Is there anything that they should really kind of keep in mind when they're shopping for health insurance?
Yes, and go with the bigger companies, because these are the companies that are going to be uh, funded, that are going to have like the history of doing exactly what they tell you that they're going to do. And make sure that you're asking like all the questions up front, even if some of them will even give you a quote in English, so that you're able to understand everything. And if it's somebody that like you're not understanding everything that they're saying to you in their English or something, just make sure that you get all your questions answered, and be completely transparent about any kind of past ailments or existing ailments when you're looking for that insurance, that you're able to tell them. Because the last thing that you want is that on a technical, or don't hide the fact that if you smoke, I mean, tell them you smoke. Even if it's like 1 cigarette a day or a week or whatever, it's better to say that yes, you do smoke. Because if say you don't say anything, and then something smoke related comes up, and then it pops up that it turns out that yes, you rarely smoke, then it could be like a reason for them to be, well, this wasn't disclosed to us when we were giving this quote, so then anything that is related to that ailment, we're not going to cover. So it's just better to always, and the same thing, if you drink alcohol, wine, if it's like a lot or a little, whatever, just be completely transparent to it. Because I mean, it's not going to affect the cost of the medical insurance greatly, but it could greatly impact the coverage that you're able to receive.
That's great. That's great. So, Susie, if people have more questions for you, or they want to find out more about GNP and, other health insurances, how do they reach you?
Well, they could come to my webpage, which is www.susimacdonald.com. They can shoot me an email at info@susimacdonald.com. And Susi is SUSI. You can find me on Facebook, on Instagram. I am like easy to find. This mug you see everywhere, I promise.
That's so great. Susie, as always, thank you so, so much for all the generous information and the time and everything. This has been really great. Thank you.
No, thank you. I appreciate you giving me the opportunity to put this information out there, because, it's things like this is what's important for people to be able to know and understand what is like. I mean, not only to know what it's like to live in Mexico, but okay, how do you live in Mexico? How do you get all of these things? Something like insurance, that is so important. And I mean, that's all I want, just to be able to put it all out there and to help anybody that wants to come here.